I'm going to be talking about generalized anxiety disorder, otherwise known as GAD or free-floating anxiety. Just to start by defining some terms, GAD is an anxiety disorder characterized by the persistent and excessive feelings of worry about a wide range of issues, including work, social relationships, and financial matters. Anxiety is the central nervous system's physiological and emotional response to a vague sense of danger or the anticipation of a future threat. This is different from fear because fear is the same kind of response but to a real or perceived imminent threat to someone's safety rather than just the vague idea of danger. The DSM-5 has diagnostic criteria for generalized anxiety disorders, starting with excessive anxiety and worry, which they call apprehensive expectation, more days than not, for at least 6 months, about a broad range of events or issues. The second thing is that anxiety is difficult for the person to control. Anxiety is associated with 3 or more of the following: restlessness, easily fatigued, poor concentration, irritability, muscle tension, and sleep disturbance. And you can see by this graphic how they all play together in a sort of downward spiral or domino effect. To continue with the diagnostic criteria, the anxiety causes clinically significant distress or dysfunction in social or occupational areas. So those are 2 of the 4 Ds that we learned about in the beginning of this class. Not attributable to the physiological effects of a substance or medication. So this means that you're not addicted to coffee or speed, and that the symptoms of your anxiety aren't really the cause of the substance that you're ingesting. There are also medications that would cause effects like this as well. Possibly, I don't actually know what they are. Anyways, the last one is that it's not better explained by another disorder. And so what that means is that possibly somebody has unipolar depression, or they have another anxiety disorder that's actually all-encompassing, and this can be explained better by that. And if that happens, they want you to diagnose somebody with the most applicable disorder instead of saying that it's generalized anxiety disorder, because that implies that it's really across the board and it can be about anything. Whereas if it's a specific phobia, it's tied to one thing in specific. Individuals with anxiety disorders tend to overestimate the danger in situations they fear or avoid, so clinicians are responsible for determining whether the fear or anxiety is excessive or out of proportion. This poses some problems because it really takes the clinician's opinion into account, and it makes their subjective decision really important in determining whether the person has disproportionate fears and anxieties or whether it's actually normal and called for. And then the last thing is that the cognitive aspects are accompanied by somatic symptoms in a lot of cases, such as irritability, muscle tension, and sleep disturbance. The features that are included in the diagnostic features in the DSM are anxiety that's out of proportion to the actual likelihood or impact of the anticipated event, which we talked about before. This is defined by the clinician that the client goes to see, and it's also defined by the cultural context that the person lives in. Also, they have difficulty keeping worrisome thoughts from interfering with their daily activities. Generalized anxiety is distinguished from normal worrying by its interference with psychosocial functioning. So that's how someone plays out their relationships. It's also more pronounced and has longer duration, occurring with or without precipitants. So that means that it can start just spontaneously on its own. It doesn't have to be brought upon by an event. And then also there's somatic symptoms like feeling restless, keyed up, or on edge. And somatic, again, is a physical symptom rather than just a psychological one. The prevalence rates are 4% in the U.S. In a given year and 6% sometime during your life. Of all people in the U.S., that is. Women are twice as likely to be diagnosed as men, and the prevalence rates are also higher in low-income, African-American, or elderly populations. They're also higher in people living in highly threatening environments, which could include dangerous neighborhoods and where violence is a possibility, or places where there are perhaps toxic, like Chernobyl and 3 Mile Island, toxic elements in the air, and this just increases the general stress rate. And whereas that has a specific cause, it can bleed into other things. The economic impact of GAD accounts for 110 million disability days per year in the U.S. So that shows that there's a huge economic impact and just loss of productivity for people missing this much work. So there are many perspectives on GAD. Sociocultural says that racial pressures and socioeconomic stress create a climate that's conducive to the development of GAD. Psychodynamic, Freud said that excessive anxiety breaks down defense mechanisms. The humanistic approach by Carl Rogers states that the lack of unconditional love leads people to be overly self-critical. The cognitive perspective, which is one of the more respected perspectives in this field for this specific disorder, headed by Albert Ellis and Aaron Beck, starts by talking about how there are maladaptive beliefs by the patient. They tend to inflate the dangers of everyday life, and they tend to play down the actual negative qualities of worrying, and they actually play up the qualities of worrying, thinking they might protect them. There's also a biological perspective, which shows that low activity of the neurotransmitter GABA perpetuates a state of excitability, fear, and anxiety, whereas GABA shuts down. It's an inhibitory neurotransmitter. So if they have a low activity of this, then the excitability will remain instead of being shut down. And then there's also a genetic component. Biological relatives are more likely to have GAD than the general population. That's 15% versus 6%. So that's a significant difference. The differential diagnosis, so this is the rule-out factor. When you're diagnosing GAD, you have to make sure it's not anxiety disorder due to another medical condition, like hyperthyroidism, that it's not substance or medication-induced, like caffeine-induced anxiety disorder, something that's actually referenced in the in the DSM. Make sure that it's not social anxiety disorder, which is easy to point out because it's usually focused on performance or an upcoming social event or various upcoming social situations, but it'll be focused on those kinds of things, whereas GAD can be about anything, getting sick, earthquakes. And then obsessive-compulsive disorder, which is also easier to spot because obsessions take the form of unwanted thoughts that are relieved by compulsions, whereas that cycle isn't really present in GAD. And then there's PTSD or adjustment disorders, which are easy to differentiate because there's an identifiable stressor, an event that happened that caused it. And then finally, we have depressive, bipolar, or psychotic disorders, which are the most common comorbidity. Other anxiety disorders and unipolar depressive disorder share a lot of the same symptoms as GAD, like eroticism, and they also have very common genetic and environmental risk factors. So these occur together, they co-occur a lot. The leading treatments for GAD fall under biological and cognitive therapies mostly. Originally, biological treatments included sedative and hypnotic drugs back in the 50s, and then they moved on from those because they were so addictive and they reacted badly with things like alcohol. Now they use less addictive drugs like antidepressants and antipsychotic drugs. There's also relaxation training and biofeedback under biological treatments. And then for cognitive therapies, there's rational emotive therapy, which was developed by Albert Ellis. And that's where the therapist points out logical behavior and thinking patterns and suggests a more appropriate perspective. And then there's acceptance and commitment therapy, also known as ACT, which seeks to accept thoughts rather than trying to eliminate them, also known as mindfulness cognitive therapy. So this is the principle that these thoughts are always going to be there. You might have a tendency to be hypervigilant or more than other people. And instead of trying to change the way your brain works and accepting it, you lessen the stress and distress that are caused by your worrying and anxious thinking. Just to finish up, there are a couple people here who are known for having GAD. There are a lot of people with anxiety disorders across the board, of celebrities and performers, but these are two that specifically had the general disorder, and it took the form of performance anxiety, but then also bled into other areas of their life. So I guess that just goes to show it could happen to anybody, and a lot of people that seem really successful maybe are dealing with things that we don't know about. Anyway, hope that was informative, and thank you for listening.